First aid for severe bleeding. Learn the right way to stop bleeding immediately. Severe bleeding is a medical emergency that can lead to significant blood loss and become life-threatening if not managed quickly and correctly. Whether at home, work, or in public, knowing how to respond to severe bleeding can save a life. Below is a detailed guide on the steps to take. What is severe bleeding? Severe bleeding refers to the rapid loss of a large amount of blood due to an injury, wound, or accident. It can be classified as external bleeding. Blood flows out of the body through a cut or wound. Internal bleeding. Blood collects inside the body, which is not visible externally and is more dangerous. The main risks of severe bleeding include a rapid drop in blood pressure, shock, and organ failure due to oxygen deprivation. Step by step, first aid for severe bleeding. 1. Assess the situation quickly. The first step when you notice severe bleeding is to evaluate the situation. Stay calm. Panic can cloud your ability to act effectively. Protect yourself. If gloves are available, wear them to prevent infection for both you and the injured person. Examine the injured person. Identify the exact source of the bleeding. Is it a deep wound? Is there a foreign object in the wound? 2. Stop the bleeding with direct pressure. This is the most critical step to control bleeding. Follow these steps. Cover the wound with sterile gauze or a clean cloth. Press firmly and directly on the wound using your hands. Maintain steady pressure for at least 5 to 10 minutes. If the cloth or gauze becomes soaked with blood, do not remove it. Add another layer on top and continue applying pressure. 3. Elevate the injured area. Raise the injured body part above heart level if possible. This helps reduce blood flow to the area and minimizes bleeding. For example, if the injury is on an arm or leg, support the limb with a pillow or your hand. 4. Apply a pressure bandage if needed. If the bleeding does not stop with direct pressure, use a pressure bandage. Wrap a clean cloth or bandage tightly around the wound. Important: do not tie the bandage so tightly that it completely cuts off blood flow to the rest of the limb, as this can damage tissues. 5. Monitor the injured person's condition. Watch for signs of shock, such as pale, cold, or clammy skin, rapid breathing, dizziness, or loss of consciousness. If these signs appear, lay the person flat on their back and raise their legs slightly to improve blood flow to vital organs. How to handle wounds with foreign objects. Do not remove the object stuck in the wound. Removing it could cause more bleeding. Instead, stabilize the object by placing padding around it, and avoid putting direct pressure on it. When to seek medical help immediately. If the bleeding is severe and does not stop after 10 minutes of consistent pressure. If the wound is large, deep, or gaping. If the injured person shows signs of shock. If there is a foreign object in the wound. If the wound is located in a sensitive area such as the neck, abdomen, or chest. Additional steps to prevent infection. Clean the wound once the bleeding has stopped, but do not clean it if there are foreign objects inside. Apply an antibiotic ointment to reduce the risk of infection. Ensure the injured person is up to date with their tetanus shots, especially if the wound is contaminated. The importance of first aid training. Learning first aid for bleeding is not optional. It is a life-saving skill. Regular training can help you respond confidently in emergencies, reduce fear and confusion when helping an injured person, improve survival chances for someone until professional medical help arrives.